Welcome everyone. My name is Vanessa Best. I am the CEO of Precision Healthcare Consultants, and this fabulous program today is being sponsored by the BOC Network. BOC does fabulous things for small businesses throughout our community, and as we all prepare to return after COVID, uh, what BOC has done is really set up different seminars based on specialty. We had one on returning back if you're in the office, returning back for personal services. This one will be construction. There'll be one for restaurants, and then there'll be another one for daycare centers. So we're really happy to have you. There's our presenter today is a safety professional. Before I introduce him, we have another person from the Precision team that is a physician assistant. For those of you who've been on the call before, her name is Vanna. She is a physician assistant, and we're going to have her just take a couple of minutes just to, from a clinician's point of view, just some things that we can all do to really keep ourselves safe and healthy during this pandemic. So Vanna, please.
Back with some of you again, and nice to meet you for those who are new. My name is Vanna, so I work with the clinical division with Precision Healthcare, and through this program, we try our hardest to develop certain policies and procedures that were backed by CDC and OSHA for different guidelines for returning to work. So we have our presenter, so I won't take up much time, but just a few things to be aware of with COVID. I'm sure we hear a lot about it in the news, but one of the main things is just being very familiar with its method of transmission from person to person, and being conscious of contaminated surfaces to person is another method of spreading. And just being familiar of your red zones is what I like to call them: your eyes, your nose, your mouth. Those are all your danger zones that you want to keep your hands away from, and just frequent hand hygiene and staying away from your face and things like that. But we'll get into more specific policies and procedures throughout the presentation. But it's nice to meet you and be with you all again. Just wanted to introduce myself.
Great. Thank you very much, Vanna. And also, just to get a sense of who's in the room, I see there's a Rose Candana. Rose, would you like to quickly introduce yourself, or what business you're with, or?
Sure. So I'm actually an intern with BOC right now.
Okay.
And Katie Parks wanted me to just come on and listen and learn more about what the methods and protocols are going to be. So I'm excited to learn.
Excellent. And it's a pleasure to have you. And then I see a Cal Nabundu. Could you introduce yourself?
My name is Kyle Wabadu. I'm a small business, and I deal with pretty much small construction work, especially for Head Starts in the tri-state area. So I wanted to see what is happening and how we can deal with going forward.
Beautiful. Thank you. It's so nice to have you. And then, oh, Gustavo. That looks like someone I know. Gustavo, could you introduce yourself?
Hi, Vanessa. Hi, everybody. Good to see everybody. I'm seeing you right now for the first time in a while. I think you know that person. Anyway, my name is Gus Jara. I'm with Arcanova Builders. We're general contractors, and I'm here today because we're going to start get back to work in New York City. So I want to be prepared.
Awesome. It is fabulous seeing you. It's been a while.
Yeah, great to see you.
Yes, yes.
Been a while.
Yes, yes. Okay, so with that started, we have a great presenter today, who I can also call my friend Aldo. And Aldo has a few certifications that has been really great with a lot of the work that he's doing with Precision. We're fortunate to have a contract with the MTA working on the Long Island Railroad third track, which we're really excited about. We've been working with them for about a year now, and Aldo has done an amazing job with leading with a lot of the OSHA training confined space, all different types of training that the employees need there through the MTA. I'll tell you about two of his certifications, and they're both from the Bureau of Certified Safety Professionals. One is he is a certified health safety technician. He is also a safety trained supervisor for construction, and of course, OSHA 500 trainer as well. He comes with years of expertise working not just here in New York State, but also in Atlanta with some very, very large contractors. And he has put together a great presentation. The one disclaimer, as you know, here in New York as well as around the country, things continue to change. So we were both on the phone last night at 9 o'clock, making sure that we still had the latest and the greatest, which is what he will be presenting for you today. So I am going to share the screen. I'm going to be his point person. Let's see. Okay, can everyone see that okay? And especially you, Aldo.
Yeah, that works really good. Thank you, Vanessa.
Okay, great. So our
Very
code,
good. So I hate it when somebody takes a minute or more to present me anytime I do a training, because that just sets really high expectations for everyone, and then everyone is so excited, and then 10 minutes into it, they're wondering, oh my goodness, where did Vanessa get this guy from? Right. But no, Vanessa's a good friend, and it's been a great thing for the past few months to really see people coming together that did not know each other. We're making connections, and people are now really seeing the need for safety, and for a passionate safety professional as I am, that's something that's a joy to my ears and my eyes. Okay, because for a long time, it's always been a battle, safety and operations. Those of you who are working in construction, especially, understand that challenge, right? It's always us against them. But I think this whole pandemic has really brought us together to realize that, you know what, it's not a battle between us and them, right? Operations and safety and business has to go together, hand in hand. So it's a pleasure for me to be able to spend the next a few minutes talking to everyone today. This is going to be a high level presentation, right? So the time allotted for it, but there's a lot that we can talk about. I wanted to start out by just telling everyone a little bit about myself in terms of how my family's doing with this whole pandemic. Thank goodness and thank God we're doing okay. My wife and I, we've been living here in New York for about a year, a little bit over a year. Came up here from Atlanta, hoping to make this home, and then pandemic struck, and all kinds of things have been happening in the past few months. But thanks God, we're doing good. I have my mom and my little brother down in Atlanta still. They're doing good. I'll tell you about my little brother here in a little bit. And then I have a sister who lives in Minnesota, right there in Minneapolis. And then I have an older brother and his wife who live in Charlotte, North Carolina. So I've been able to kind of track all these things that are happening, from my family, and just kind of seeing firsthand how the last few months have been affecting different areas. So that actually helps when doing these presentations as well. I am very well connected with a lot of large general contractors still, just from networking and from working together on joint venture projects. So, when this whole thing started, I picked up the phone and called a few people, and I said, hey, what are you doing? What is the J. Duns of down, in the South, New South, Gilbane, Turners? What are you guys doing to reopen? Because if you want to do the right thing in terms of reopening, especially for construction, you have to look at what the big players are doing. They obviously will go above and beyond. I mean, I think a week into it, a lot of these people already had all kinds of plans and protocols and procedures set up. So a lot of what I did is I gathered all that information and I kind of combined it and made it into a small, 45-minute presentation, just to give you guys some ideas of what's required and what things to look out for and what do you need to do, right, to be able to be prepared for reopening. But I told you I would tell you about my little brother, right? So my little brother, he's 24. He's in safety as well, working with a large general contractor down there. We're working at the Atlanta airport and projects of that size. But he's still a young blood. You know, he doesn't like it when I call him a young blood. But he proved once again why he is, right? And so about 1 month and a half into this whole thing, when things blew up down in Atlanta as well with the pandemic, I was on the phone with my mom, and she just, you know, casually tells me, "Oh yeah, Alan, my little brother, he just left the house." Oh, I said, "Okay, cool." You know, at this time, everything was shut down already. You know, people were getting symptoms all over the place and exposed. So then I said, okay. I said, how is he? How's everything? He's, oh, no, he's good. And my mom just very nonchalantly starts telling me as well. She says, well, you know, he did complain that for a few days he's had body aches, and you know, and he's had like a little bit of a fever, and he even stayed home from work one day. He couldn't go to work, just didn't feel up for it. And I have my speakerphone on, and my wife, who's a nurse, you know, we're both on the phone listening to him. And then she says, and he also for some reason he lacks taste, and he can't smell. And so by this time, my wife and I are just staring at each other in the car. And anyways, long story short, I called little brother right after that. I start drilling him, and of course, as little brothers will do, he knows everything. He's done everything. So why is older brother calling him to question him? He knows exactly what he's doing. I said, you need to go get checked in. You know, I'm not even worried about you. I'm worried about my mom. Okay, because she's the one that's older in age, and I need to make sure that she's okay. Anyways, after that upsetting conversation to him, he goes in, and then a day later, he sends a message to the whole family. You know, very, you know, tail in between his legs. Hey guys, so I got checked out and I tested positive for COVID-19. All right, so that was I guess the moment where I finally said, oh man, it hit home. Right, it hit home for us. Now let's make sure that he's okay, his wife's okay, and let's make sure for sure that my mom's okay. Uh, Thankfully, everyone is fine out of it. But the reason why I say that is because, you know, this is something so new to everyone. And obviously, we've seen it in the news. Let's not even get into all the news out there, but there's all kinds of explanations for everything. So if you're a business owner, if you're the leader of an organization, if you have a position of leadership, management, you need to understand that things are going to change. Vanessa said it right now. Now things are changing. They were progressing. Now we're regressing in many parts of the country, right? So it's very important that us as leaders uh, don't only just look at the business side of things, but we look at the life side of things, right? People are losing their lives. Don't let it become a situation where one of your people that depends on you to take care of them, you know, may it not affect their lives as well. Okay, so that's really kind of a little introduction, a little tidbit of what we're doing. If you'll move forward, Vanessa. Um, you know, speaking of business, it's definitely not business as usual. And I think by now we all understand that. If we don't understand that by now, then there's other issues there, right, that we can't fix today. But it's not business as usual. As a business person, as a business leader, you might follow people like Mark Cuban. I love a couple things that he said in an interview early on during the phase of reopening the country. He said not only is it a safety issue, it's a business issue. You know, so even people at his level of business are realizing, you know, how important safety is to the business side of things. And then he followed that up by saying how companies respond to that very question is going to define their brand for decades. If you rushed in and somebody got sick, you were that company. If you didn't take care of your employees or stakeholders and put them first, you were that company, right? So definitely something to think about. People at this level of business are understanding that, which sometimes we might think they're all about the dollar, right? Chasing the dollar. But so especially for a small business, especially for those of you that are starting businesses or trying to scale your business, you know, you have somebody from your small business get hurt, that's a big percentage of your personnel, right? And it's not only that you're losing a valuable employee possibly, now you're that small business that, you know, went at it, went back at it, did not have a plan, was not prepared, were not training, didn't have the proper PPE, the proper protocols, procedures, policies in place. And now you're that company in the newspaper. Okay, there's an outbreak at so and so business. That is something that will knock you off, right? I mean, it might not knock off someone like Mark Cuban. He'll get back up from that, but a small business won't, right? So definitely something to consider and just think about and keep in mind. If you move forward there, so the purpose of this training, again, very high level, right? I hope you don't feel like we're rushing through it. At any time, if you do have questions, um, just wait till the very end. Some things might get answered. If you have questions that come up, jot them down on a piece of paper, and then at the end, we can spend a few minutes trying to tackle some of those as well, right? And again, this is high level general guidelines for construction employers and employees. You know, basically, what are some of the things that you can do to minimize exposure? What are some of the big players, like I said earlier, what are they doing to be able to be prepared for reopening? We'll discuss some really good best practices, again, that are coming from these type of organizations that have served them well. You know, anything you can do is great. The worst thing that you can do is not do anything and just think that this pandemic is some hoax or that it's not going to affect you or your loved ones or your employees. Absolutely not. Okay. So these best practices definitely something to consider. And then we're going to share some resources and tools. Okay. I think Vanessa was even going to put out a little package for you there to keep. So you have some valuable links. You know, as always, the place to go right now, CDC, right? That's a national organization. We understand that, well, I mean, I think most of us understand that that's where we need to get our information, right? The CDC for the most up-to-date information and guidelines. At the same time, you do have OSHA. OSHA has put out a lot of good resources and guidelines as well for construction specifically, also for general industry, of course. But just keep those things in mind. If you flip over to the next slide, I think I've got some of those there. But just really important to stay informed. With everything changing constantly, I put this map out here and I wanted to leave it because even though it's not updated, this was May 20th. Okay, you see last updated May 20th, 2020. If you look at that link now, you could go in and then you can see how much has changed. And some of those states were already reopening, right? And now they're going back to shutting down. So just to prove, right, everything is changing constantly. Make sure that you're aware of the local agencies, you know, your industry agencies, your national, state. I have to say New York has in my opinion has done a really good job of giving out resources, templates. We'll see some at the end of this presentation, but you know it won't. It is work. You do have to dedicate some work if you're going to tackle this on your own to come up with plans and procedures. You do have to set some valuable time aside and some hours, right? And really do all your investigation through these sites. The CDC website, of course, the AGC website for construction. They are constantly updating that web page with different resources for small construction companies, for medium-sized construction companies, and they get a lot of their support from the large players. You know, so the Turners, you know, your Skanskas, your Gilbanes, they put a lot of effort into the AGC because they're partners with them. Okay, so they're members. So a lot of those resources that they have that you might not have access to directly through one of those organizations, you might be getting the same stuff that they have going to a website like the AGC, even the ABC as well. Okay. Feel free to take pictures of any of these slides for your information at the end. You know, if you want to keep some and local government websites. Okay. So with OSHA, if you go to the next slide, um, with OSHA, it's a tricky situation, and I don't mean to scare you. In my experience with OSHA over the past 15 years, it's OSHA are not bad people. Okay, OSHA is just like any other organization out there. They're backed by, obviously they're a federal, um, they're backed by the federal government, and they're a federal organization, but they're just out there to do a job. Okay, and so a lot of construction companies and a lot of construction people are very fearful of OSHA. Where would we be without OSHA? Okay, that's the question that I have for a lot of people. Where would we be? I mean, we were literally killing a person per floor, you know, and here in New York City, you all know how high these buildings are. Okay, 100 stories, that means 100 people were going to get killed. That was in the 20s and 30s and 40s. You know, since OSHA was established in the mid 80s, we've seen a dramatic decline in fatalities, right? So it's not a bad thing. If you don't have a safety manager that works for you, if you don't have a safety consultant that works for you, it's not a bad thing for you to go on that website, right? OSHA.gov, and get familiarized with that website. You have no idea the resources and the information that OSHA throws out there just to help contractors, you know, be on par, right, with their mandates and requirements. So when it comes to OSHA, there is no requirement for COVID. We understand it's a new thing, but OSHA did send out a mandate where they spoke about the possibility of them going out to construction sites and actually enforcing folks to be able to follow CDC guidelines, right? So even though it's not in their standards, like there is no standard for COVID-19, you know, you'll find a standard for ladders, standard for fall protection, cranes and derricks, electrical. You won't find a standard for COVID-19. But what OSHA does is they do what they call a reference, and they'll reference to the CDC guidelines, right? So if you're not following CDC guidelines as a business, then they can cite you for a different number of reasons, even though there's not a set standard, right? So they can cite you one, PPE is probably the most common one, obviously because the CDC requires certain PPE for workers in different tasks and operations. But the other one is the general duty clause, okay? If you're not familiar with this clause, it's basically an open book for OSHA to say, look, we don't think that's safe, even though there's no standard, even though I can't pinpoint where in the book it says that you're violating a law, an OSHA requirement. I'm still going to cite you for the general duty clause. So basically, that's one of those gray areas that OSHA has, many of them in their requirements, in their standards, but this is probably one of the bigger ones. So be familiar with the general duty clause, which is probably the one that you'll get cited for in the event that you do have an enforcement officer come into your site and want to walk the site. You know, the first thing he's going to ask you, okay, so what is your plan? Where is your plan for reopening after COVID-19? Okay, and he might ask you how many employees you have, right? How many people you have working for you? How many are on this site? Okay, so show me the plan. Now you have a plan, but it's not being implemented, or you don't have a plan. Hey, what is that? What do you mean a plan? You know, that right there just opens the door for everything else. So keep in mind, OSHA will come out for a number of reasons, but right now we're seeing a lot of whistleblower complaints. Okay, I read yesterday, I think, I forget the exact number, but it's a high number of whistleblower complaints, people that are basically speaking up about their companies that are not taking the measures to protect them, right? So OSHA, that's a law that protects every one of us who are employed by somebody. Okay, if we don't feel safe in our work environment, the Whistleblower Protection Act in OSHA, protects you, okay, from any kind of the company coming back and firing you, retaliation whatsoever. So people are going to start doing that, okay, and we're going to see more and more of that. And again, it's not to scare you, but it's also another incentive, right? Mark Cuban said it: just treat your people right. If you take care of your people will take care of you and your business. Okay, a couple of good resources for OSHA. Here they are. Again, you can have access to those easily. So if we go into general guidelines for employers, okay, so these are some of the general guidelines that you can keep in mind as you're preparing to reopen. So stay abreast of guidance from all the agencies, okay. Don't just stick with CDC, and that's great. Obviously, that's where you want to start, just to kind of see what's going on at the national level. But you know what? Depending on how things go and these outbreaks start affecting, local areas, you need to make sure that you understand what the local health agencies are recommending. Okay, and they might supersede what the federal level is doing. At the end of the day, as a business employee, you have your own little government to run there, right? And a lot of people that might depend on you. You have to do what's best for them and for yourself and your business. I always tell people OSHA is the bare minimum. Okay, OSHA is the bare minimum. OSHA says that you must tie off at 6 feet from the leading edge. You know how many people die or are severely injured from a fall that is below 6 feet? A lot of people. Okay, you can trip over a rock and fall and hit your head on a concrete slab, or impale yourself with a piece of rebar, and it's going to change the rest of your life, right? If not kill you. OSHA is the minimum. And why? Well, there's politics and there's finances involved, and so they can only do so much. So more is better. And we understand, as a small business, um, safety is one of those things where a lot of times you want to skimp on. And that's absolutely the reality of it, right? You're trying to do the payroll and you're trying to get the material and equipment and finish projects. Um, However, again, one person gets COVID, okay, from your company, and even worse off, they propagate it, right, or expose others, and now you have an outbreak. Guess what? There's no jobs or no dollar amount that's going to get you out of that, especially if someone is affected, right, or even killed. So make sure that as you're coming up with this COVID-19 preparedness and response plan, and that can be the title of your document, okay? COVID-19 preparedness and response plan. If I'm an OSHA enforcement agent, if I'm any sort of agent, and I get to your job site and I say, hey, Gustavo or Gerardo or whoever it is, can I see your plan for COVID-19? Oh, here you are, sir. And it's a nice binder, COVID-19 preparedness and response plan. You know what? As an enforcement agent, I'm already feeling the warm and fuzzy about you. Oh man, these people are ready. They're prepared. Okay. Um, Again, not to say that you only want to paint a beautiful picture and it's not getting implemented, right? Because the worst thing that could happen is now they take that plan and they go ask your employer or your employee, the first one that they come across, and they say, hey, so what is the protocol for if you have symptoms? Uh, I don't know. You know, no, there should be a protocol. Who am I going to call from the company? It might be you. It might be someone that you designate. You're going to be the point person for COVID-19 related issues. Okay. Everybody has to have that number. You have any symptom, because everyone is self-monitoring, obviously, and that's part of your plan. You have any symptom, don't come to work. I don't care if we have the most important pour of the week or the month, okay? I'll find a different guy to come help me finish. But you don't come to work and you give me a call right away. Doesn't matter what time. So, these are unique times. You're going to have to be willing to do unique things, okay? And a lot of that is going to come down on you as business leaders, okay? So, and obviously take that guidance, and then obviously incorporate it, make it applicable to your own workplace. Okay, don't take a plan that might work for a company that all they do is architecture and design firm. They're all working in an office setting and try to, copy and paste and put that into your underground operations, okay, where you're setting pipe and culverts and pouring concrete every day. It's not going to match up. Your plan should consider and address the levels of risk. So this is where a JHA works really well, job hazard analysis. A lot to talk on that subject, but for COVID-19, it's a great tool. Okay, so basically, you take your tasks that you're performing every day, your routine tasks, and you break those down into steps. Okay, step one, unload. Step two, set in place. Step three, whatever it is, those steps. But then you have another column where you say, okay, what are the hazards with each step? But in this particular case, you're looking at it from the COVID-19 standpoint, right? Uh, can they do this while maintaining 6 feet distance? Uh, will they need extra protection, extra PPE, right, to protect them? Okay, so then what are the hazards? And then at the end, that's where your third column would be is, okay, what can I do to mitigate these issues? Okay, how can I protect my employee from being exposed, right? So that's just over the top, right, for JHAs and how you can use this. And then your plan should also consider and address the other steps that employers can take to reduce the risk of exposure. Okay, and we're going to talk a little bit about those here in a little bit. So if you go to the next slide, um, again, some more guidelines. After your plan, now you have to prepare to implement basic infection prevention measures. Okay, so one thing is having your plan that you can present to your workers, and that plan needs to be presented to your employees. Okay, and in safety, if you didn't document something, it never happened. Okay, this training today, if there's not an email thread, if we don't have a sign-in sheet or a picture of who's on here, it never happened. Per OSHA. So you can tell them, oh, I took a nice, hour-long session on this, and well, you have no proof of it, so it didn't happen, right? So make sure that you not only come up with the plan, but you take the time to train your employees on it, okay, in a way that they'll understand. All right, so that's important. Um, these basic infection prevention measures, it's amazing how much we've all discovered that we knew so little about washing our hands, right? Um, Again, everybody has a different thought process, a different definition for washing hands. My definition of washing my hands prior to this was completely different from my wife's definition. Okay, so I learned quickly you have to adapt, and during these times, even 20 seconds, right? Isn't that what they're recommending, right? 20 seconds of hand washing. If we were to do it, I don't know if you've done it, right? But if you just sat there and counted, one Mississippi till 20, it's a long time. It is a long time. So, but that's one of the basic ways that we can help our employees and our people stay safe, right? And away from COVID-19. Um, Frequent and thorough. Okay, so if you have to write up signs, you know, if you have to have a little look, it wouldn't take you but 10 minutes to get your crew together one day, print out a sign-in sheet that says, COVID-19 hand washing protocol. And that's the name of your toolbox talk. Okay, 10 minutes. It'll take you to take them to the port, wherever you have your sanitation facilities, and say, guys, this is how we're going to do it. Okay, and then you do it. You have another couple of guys do it. Everybody's having a good time, making fun of each other, but they're going to get the point, and you're going to have a sign-in sheet that you're going to put into your files where you did training on hand washing. Does it sound like something minimal? Does it sound like something so simple that carries no weight? It might, but again, I'm telling you these things from like an OSHA, enforcement agent. That looks good to me. I start seeing these things where, oh man, this 20 employee company took the time. I don't know how long it took you, I mean, but you have the proof, you have a nice little sign-in sheet where everybody understood, and you basically, in 3 or 4 lines explain what you did, right? What the training consisted of. That looks really good. Okay, obviously make sure that you're doing it, not just printing these things out. Um, Encourage workers to stay at home if they're sick. All right, that's a very basic one. We should all be doing that and encouraging them to obviously self-monitor all the time, right? Promote, encourage physical distancing, respiratory etiquette. Again, covering coughs and sneezes. How many times are you out there? I had never noticed it so much. I had never noticed it so much until now during this whole COVID-19. Now I see if anyone sneezes and they're not covering their mouth, it's like I know that, like, to look there at that precise moment. It happens all the time. People have different etiquette on it, and so now you see how exposed we are, right? So at work, where a lot of these guys spend more time with their coworkers, even yourself possibly, than sometimes with their own families, you need to make sure, again, this could be another toolbox talk, right? To add to your file. Okay. So again, these things sound small, but not only will the training help your people, but it also makes you look like you're trying your best, right? And that's what we all can do, try our best. Discourage workers from using other workers' tools or equipment. That's tough. Some tasks you have to work next to somebody, right? Some tasks you have to have two people on a tool and share tools. You're not going to be able to implement everything, but what I tell people is do your best. Okay, try your best, and that way, if something does happen, look, you can honestly tell yourself you tried. All right, you tried, and you gave it your best shot. Okay. And then 6, maintain regular housekeeping practices. This is a good one. Now, as humans do, okay, I've been walking construction job sites for, again, over 15 years. People drink a Coke during their break, and there might be a dumpster, a 5-yard dumpster right there next to them, and they're going to throw it on the ground. Okay. They smoke a cigarette butt. There might be a cigarette butt container, and they're just going to throw it on the ground and step on it. They're going to use a dust mask or a face mask now that's disposable, and they're going to sneeze in it and cough in it, okay, and sweat in it. And guess what they're going to do when they're done and it's dirty? They're just going to throw it in the ground. So now you have all of these things carrying so much stuff, right? What are you going to do? You got to have housekeeping has always been a nightmare in construction safety. Okay. You can go to any job and it will always need more housekeeping. However, now it's not just that it looks dirty. It's not just that it creates tripping situations, right? And makes the job look bad. Now there's the disease out there, right? That you're transmitting. And now somebody has to come around and pick that stuff up, right? Or be exposed. So please, right, make sure, again, that could be another toolbox talk, right? Housekeeping issues, okay? How are we going to manage this? Who's going to be the COVID-19 housekeeping Superman, right? Whatever you want to call them, whatever you want to designate them, but they're going to be the ones that are going to be tracking these things, okay? And incorporate that into your plan, okay? You have a COVID-19 housekeeping inspector, whatever, leader, okay? If you have an office setting, you have someone in your office who's your COVID-19 office leader. What's their job? Well, their job is to make sure that people are not getting together in the break room, make sure that people are working in their different areas and cubicles and settings and maintaining physical distancing, making sure that people are washing their hands as they come in. He may be the one, or she may be the one, that in the mornings does the questionnaire, does the temperature screening, right? And you, depending on your organization, you might need 2 or 3 of these people, right? But all of that should be documented in your plan as to where any employee can have a copy of that plan and say, okay, I need to talk to so and so because we're out of dust masks, right? Or we out of hand sanitizer. Okay, and so we need to get that replaced. I know who to go to. Obviously, you want to make it work as efficient as possible, and those are just some things that you can do to help with that. Develop policies and procedures for prompt identification and isolation of sick people. Okay, so your employees right away should know that they need to be self-monitoring. Okay, and they need to know that they need to be monitoring those around them. Okay, that's probably one of the biggest things that's happened. People get asked in the mornings, hey, are you feeling okay? Everything well? Any high fevers? No, I'm fine. But you know what? The wife has been sick for a week, and she has all kinds of symptoms. So a lot of things are not as common sense as you might think. So that's where your efforts, in coming up with this plan, um, really will benefit you. Okay, is anyone in your household okay having symptoms, or is anyone around that you've been around or in close contact with having these symptoms? Those are questions that are more guiding towards getting a good complete answer. um, Among these policies and procedures, employers should develop these also so that employees know uh, who to report to when they are experiencing COVID-19. Like there should be a hotline number. Like there should be a hotline number within your company, and that could be just your number, right? You call me as soon as you start feeling ill. You call me, and we're gonna have a conversation. And at that moment, from that very first phone call, your documenting work begins. Okay, you gotta document. Everything has to be documented. Okay, and it's a protection for yourself and your company as well, but it's also protection for them, right? But so I'm a little bit on both sides. I've always been on both sides. I've always looked out for the companies that I've worked for, but I'm human and I care for people just naturally, and that's what I do. And so you always have to trek that line. And I've told people, even if when I was working for Gilbane, someone didn't get treated right, injury management didn't get treated right, and I would tell them, hey, do what's the best thing for you in the long run. Don't worry about me. Don't worry about Gilbane. Gilbane's gonna get through it. Okay, Turner's gonna get through it. No, but you're not going to get through it. Okay, so you have to make sure that your people understand that, as well. But at the same time, you're protecting yourself as well. And then employers should develop policies such as a return to work plan, right? So just like you would have someone that's been injured, you should have a plan for them, right? How to return to work. Again, you should have something for a return to work plan for COVID-19 people that have actually tested positive, right? So okay, what is that plan? You quarantine for 14 days. Can you want to play it safe and just say, hey, go ahead and take another week off, or whatever days off, as long as everything is going good, come back, right? When you come back, we're gonna sit down and we're gonna fill in this form where basically you're gonna tell me that you say that you follow the quarantine recommendations. You've been testing yourself at home. You've been screening yourself at home. Did you go to the hospital? Did you go? All that has to be documented because that's going to help you make that decision whether to allow them to get back. Right?
Excuse me, Aldo. Just want to interject just one small thing.
Sure.
With the documentation, how important that is, especially with the questionnaires. So if there's a person that's administrating those questionnaires, it needs to be documented. The only thing that we are not allowed to document because of HIPAA is the temperature check. So that would be a HIPAA violation when you're taking a person's temperature to document that. You still have to be aware of it, because if it's like 100.4, then you have to make a decision, according to CDC, they really shouldn't be working. But just be mindful, Just as Aldo said, everything needs to be documented except the temperature check. Because if you document the temperature check as an employer, that would be a HIPAA violation. So just a small note to keep in mind. Please.
Thank you, Vanessa. I think Vanna had something. I'm not sure.
Sorry. Yes, I just wanted to comment on that. So let's say your employee has a temperature. He comes into work with a fever. He has a 101. That itself can be documented that day because you're documenting that they were sent home because they had a fever. What it is that we don't want to document is every single day. Today they're 98.6, tomorrow they're 97.4. So we don't have to keep a record of it, but it can be documented if it is definitely like a febrile patient. If they come in with a fever that's high, then obviously we're documenting they're sent home with a 101 fever. But just to clarify, we just don't want to keep a record every single day of 98.6, you know, of every single employee. Just to clarify a little bit.
Thank you.
Very good. Very good. We can go to the next slide. So this guy here, some of you may have seen it in the past. I could spend hours and hours talking about this. This is a big thing for safety, folks. The hierarchy of controls. Basically what it is, it's a triangle that helps you figure out what kind of methods and controls you can use to eliminate hazards, right? So obviously at the very top, that's the most effective, right? In this case, you think about COVID-19. Can we eliminate the hazard? No, we cannot eliminate it. It's out there. Okay, so then we cross that one out, and then we try to go to the next most effective control, right? Substitution. Can we substitute it for the Spanish flu, you know, or something like? No, you know, we can't do that either, and I don't want to do that. So it's impossible, right? You go down engineering controls. What is that? Well, that's, you know, an example would be isolating people from the hazard, right? That's an engineering. You can design a situation, a task, an operation where now you're protecting others, right, from a hazard. So in this case, can you isolate people? Absolutely. That's exactly why we're doing the temperature checks. That's why we're doing the self-monitoring. That's why we're trying to keep, you know, physical distancing. And if somebody has symptoms, right, then they're home. You know, they're not allowed to come into work. So we're engineering that hazard out per se. Okay. Another one too is administrative controls. You know, with COVID-19, you know, what that would mean is things that you can administratively do as an employer, mostly an employer, to protect those that could be exposed, right? So what is that? Well, training. That's something that you can do, right? Give your people proper training on COVID-19 and all the other things that we already spoke about. Go through your plan. Signage, that's a big one, right? Signage, you know, a lot of people don't see the value in it, but and some people use it, but they don't use it effectively or as effectively as they could, right? So you know, you go to the bathroom and there's signs now everywhere. Please wash your hands. Please wash your. Well, that's great. You know, that's great that you're doing that. You took the time to print out these signs and post them up in the bathroom walls. But why not, if you're already going through that trouble, right? You know, post a picture of someone's family, right? And say, hey, do you want to take COVID-19 to your loved ones, right? Things that will tug at people's hearts and emotions, because at the end of the day, that's the only way that humans react. Okay, we don't react naturally by doing the right thing all the time. Or that's not humans. Okay, and we know that we want to take shortcuts. We want to go the easy route. That's just human tendency. So you have to try to get to people's hearts in a way, even during this pandemic, as serious as it should already be for everyone. It's not, you know, and you're looking at it, people are not taking these things seriously. So those are some examples of administrative controls. And then at the very bottom of the pyramid, the least effective method to control hazards, okay, and protect people is PPE. Whereas if you ask some people, they'll tell you, no, PPE is the most effective. No, it isn't. You know, the moment I tell you that I have to give you PPE is I'm telling you there's a hazard that can hurt you, right? I mean, the moment that I put you on a harness and I give you a lifeline, I'm telling you, you're exposed to a fall that could kill you very easily. So that's why I'm giving you PPE. It's the last resort, okay? Uh, I couldn't eliminate it. I couldn't substitute it. I couldn't engineer it out. There was no control in my hands to be able to get it where I didn't have to put you on a lanyard. So here we are, right? So PPE is something that we need to have, but at the same time, make sure that you're not just going immediately the PPE route all the time. There's other things that you can do prior to handing someone PPE. Okay. But obviously with this pandemic, PPE is huge. We're going to need it. Okay. And then these, go ahead and go. These three, I'm just basically talking about what we just spoke about. I actually forgot I had some stuff in there.
This one, Aldo, or next?
So actually you can pause there. When you do signage, make sure that if you have people that speak different languages working for you, it doesn't take much to Google, okay, a translation. And it might not be a perfect translation, but it'll help, right? Because if you have a lot of Spanish workers that don't speak English, for instance, and you have everything in English, right? And I'm an enforcement officer for OSHA, okay, and I'm gonna start talking to someone in English and they don't speak English. It's obviously gonna tell me, okay, unless you had an interpreter, and where is it documented that you had this training and you had an interpreter present, right? Or who did the interpreting? Just something to think about as well. Okay, go ahead. Oh yeah, this is okay. Go ahead. Administrative controls. We talked about that, and then PPE, right? So again, training goes a long way with PPE as well. The one thing about PPE is N95 masks. Now everybody knows what an N95 mask was, right? 4 months ago, only people that were working in healthcare and people in construction, cutting concrete up and stuff, knew what N95 mask. The thing about it is, the moment you hand somebody a N95 mask, which is defined as a respirator, okay, a dual band N95 mask, you're giving them a tool that per OSHA you gotta do some other stuff along with that, okay. And there's it can either get to appendix D, I think is the form, but it's also a medical questionnaire. Make sure that employee is physically able to don a respirator, right, for a certain amount of time per day or per week. And then depending on that medical questionnaire, which again should be filed into the employee's file or folder, it could lead you to want to take them to the doctor, and get a pulmonary function test, right, to make sure that they are able to have a respirator on. So those are things that you don't want to create a hazard by trying to eliminate a hazard, right? So somebody has pulmonary issues and now you give them a respirator, and now they have a major catastrophe physically because they were wearing a respirator for 3 hours. Right now it really bits you in the butt, right? So something to keep in mind. Okay, make sure that whatever equipment, tools, PPE you're giving, that you're familiar with the risks and they have training on it. And then I think the next slide, we're talking about yeah, perfect. So kind of wrap this up here, and kind of what we've discussed, and just some things for you to take with you as well. Best practices. Develop and implement a plan. Okay, so that's basic, right? If you fail to plan, you're planning to fail, right? That's how the saying goes. Train your employees on this plan, document everything, enforce proper hygiene, physical distancing, regular housekeeping. And when we say enforce, you have to enforce these things, okay? However you want to enforce them, just like, if a guy's not following your vacation policy, right? If he doesn't have enough vacations and he's taking more, or maybe he's not getting to work on time every day, he gets there half an hour late, at some point you're going to enforce that, and you're going to say, look, I can't have this anymore, right? Either you start showing up to work early on time, or you're done. So 3 more strikes and you're done. If you don't enforce these things, you're not going to get anywhere. Okay. And we're not saying, just fire people and get rid of it. No, that's the last thing that any of us want to do. But at the end of the day, you can show them that you care only so much, and that you're concerned for them only so much, right? Everyone has to contribute and cooperate, right? I would tell people at my projects, listen, I will love you to death as I walk you out the gate. Okay. I will love you all the way down the gate, down the buck hoist, from a 50-story building that we're working on. And you will be my friend the whole time. Okay. But I will love you out the gate, because at some point we've talked and we've talked, and talking has done nothing. Right. So I'd rather get you hurt some other job, some other project, but not on my project. Okay. So, you have to try, but enforcement sometimes is necessary, right? Assign 1 or 2 employees, and that could be more than that, depending on your operation or business, as your COVID-19 captains, right? You could have one for the field, one for the office. We spoke about that. Someone that's going to be the designated person to file everything, document everything. They need to be the most familiar person with your plan, okay? To the point where, hey, what do we do in this scenario? Boom, they know exactly what to do based on your plan. Okay, you got to have someone like that. Well, I'm saying that's as a best practice, right? Use signage in break rooms, bathrooms, shared spaces, and then also common areas. And again, make effective use of your signage, and develop a playbook, right? A lot of us maybe are familiar with playbooks. Is basically, a guideline of how to respond to a certain scenario. People have playbooks for active shooter and playbooks for, thunderstorms and twisters or whatever. You need to have a playbook, in case the moment someone tells you, hey, I've got symptoms, boom, flip through your playbook. Okay, who do I call? How many calls do I have to make? What do I have to document? What do I have to, that way it's always consistent and you're not missing anything. Because usually in moments of panic or in moments of uneasiness, we forget important details. So if you have a playbook, you flip it open to that page, and then all you do is just go step by step, right? And follow the instructions that you've set out for yourself. And obviously that playbook should also, part of it should be how to return to work, right? Okay, someone's been out for 14 days or whatever amount of time they've been out for. Okay, what do we need to do now that they're coming back? Okay. Investigate and document all cases, confirmed or unconfirmed. Okay, that's huge, because right now we're still learning about this virus, right? So we don't know, tomorrow, a month from now, they start saying something about, hey, for the past 4 months, guess what? We just learn and figure out that this is what's been happening. If you have it documented, whether somebody was confirmed or unconfirmed, it's easy to pull information out, that's going to help you track things. Okay. Again, it could become a meaningless task, in some cases, if nothing comes out of it. But again, those are things that when OSHA shows up, and again, I bring OSHA up again, but OSHA shows up, you're going to pile up your file cabinet of COVID related things. This is that. You know what? That OSHA officer might just say, okay, hey, listen, you got it under control. Love what you're doing. Keep it up. I'm out of here. Okay. Have a good day. If you don't have anything, it's going to give them the idea that you're lost. You haven't even tried to do anything. And keep in mind, these people know that all the resources are out there. There's templates, there's guidance, so, and it's free. So if you're not doing it, what they're going to do is they're going to convert that inspection from a focused inspection, which could be just COVID-19, to an all-out open inspection where they'll look at your fall protection, your PPE for everything. I mean, they'll go in and tear up your job site, right? So you want to keep it to a minimum. Okay, and then follow OSHA's guidance on recordability, okay, of COVID-19 cases. There is guidance on that as well on the OSHA webpage. Just real quick, some tools and resources for New York construction companies. These are some, this is what New York State put out, okay? And I think, honestly, I haven't searched out other states. I would hope they have something similar, but they've made these specifically for different industries, okay? So this is the one for construction, and it's for employers and employees, okay? So it gives both sides of what people should be doing. It gives you what's mandatory on the yellow column, right, under the yellow line, but then it also gives you some best practices, okay, that you can implement along with and a lot of what we've talked today is included in there. This is obviously a free resource. There's the website. Go download it, and this is actually a really good start for you, okay? If you start with this, you can work around this and then start. Basically, you're going to figure out that there's a lot of things that you need to do from this 4-page document, which is going to help you be ready. Okay, so, and then the last page, I wanted to share some tools and resources for employers and employees. I think it's, yeah, so these two forms, again, just examples of the things companies are using. One is, for example, the one on the left, COVID-19 operating practices, right? So it's an easy, clearly defined task sheet, basically, okay? Whose responsibility is it to maintain the cleanliness of the areas, of the common areas? Who collaborates with that? Is that task done daily? Is it done weekly? Is it as needed? So again, these two documents as well, a good place to start, okay? Just to kind of see what applies to your business, to your industry, the size of your operation. And the one on the right, employee COVID-19 safety checklist. It's a daily checklist. So just like a safety document that you fill out in the morning, every employee should have one of these. It could have one of these. It's got really good questions. For instance, one of the questions there is, did I get a new mask and new gloves at the beginning of my shift, after breaks and after lunch, right? Am I practicing 6-foot distancing in my work area during lunch breaks and when I enter and leave the workplace? So it's just some questions here that the person can initial, yes or no, right? At the very end, my special coronavirus cleaning tasks. Now that person specifically maybe is assigned to do a quick cleanup of the bathroom in between breaks, of the kitchen area, whatever the case may be, right? And then when they did it, completed, at the end of the day, they turn it in. It's paperwork. It's a headache. Everybody hates paperwork. But in the long run, this is what it's going to take, right? And the companies that are actually trying to implement these things, the companies that are willing to put in the effort, the resources to do these things, I think, in my opinion, are the ones that are going to keep growing, okay? Because people are going to realize who's going to take care of them. And people at this point are realizing, hey, it's either the safety of my family and myself, or I go to work in this place where they're not taking care of me, right? So it affects everything. It affects morale. It affects productivity. And obviously, it affects your bottom line as well, right? Whenever those things are happening. So the last page are some additional resources that you can also have. I think those are included with what Vanessa's doing for you guys. Just some good documents there to have. I think someone just asked, can we get these documents? I think, yeah, Vanessa's going to send those out, I believe. to everyone.
Yes.
And then
Yeah.
go ahead. Go ahead,
No,
Vanessa.
go on out.
Yeah,
Yeah.
no, no.
So
Go
we're gonna have these resources. I think the only thing we did not include, I think that the two checklists that are in like a Word document. So we'll get those over to you as well.
Very good. So then I guess we can go to the last one. Beautiful picture of Vanessa there. So questions, if anybody has any questions.
I'm sorry. I'll just add that you're also hey, there's a template for return to work that you have to have listed, not just, but it's for any business employee. Have a copy of that as well in your packet of information.
Very good. So I don't know if anybody had any questions.
All right. Were there,
Hey Aldo, thank you for the information. It was really helpful to see where is the focus in the construction industry. We've been receiving great information from Vanessa, and I noticed that there is like difference in practice in each industry, but the basis remains. Uh, I was wondering, like, will the New York Forward Safety Plan will be acceptable for OSHA inspectors? I think that's a really user-friendly plan template, but I'm not sure if that will be acceptable for them.
You know what? I haven't heard of anyone using that specific template.
Mm-hmm.
And there really isn't a template that will do all fit all, right? It's got to be something that's specific. As long as it's specific, you know, I've seen safety programs through the years that are, you know, misspelled. You know, there's no pretty colors in it. They're simple, a lot of handwriting stuff in there. Do you know what? If it's got what I need as a safety manager, if you're covering your bases and you're telling me what I need to hear, that we're gonna work with that. You know, it doesn't have to be pretty and colorful and you know. So I guess to answer your question is as long as it's specific to what you're doing, right? And an enforcement officer, you have to remember their job is to review these kind of things, and they've been doing it for years probably, and they can pick out the good ones, the bad ones, the ugly ones very quickly. So don't 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 shortcut with stuff like that. That's what I would tell business owners. Get it done right.
Great. Thank you, Aldo. One more question.
Yes, sir.
What is your opinion on will the construction business will decrease capacity because implementing these safety practices, or you think they will be at the same level of capacity as before?
You know, well, for now, construction is fully open, right? So especially essential construction is fully open. It's at 100% capacity. However, though, that can change. You know, if we have a bad outbreak again, if we start seeing a spike in numbers, I can tell you, I think from what we've seen so far, I think the government of New York is not going to take things lightly. You know, I think they're not going to give it a week or so to see how things work themselves out. like other states have done, in many aspects. I think they're not going to waste time, and they're going to rush into it, and it could very easily become, again, hey, only essential construction, right? And so as far as the capacity in terms of operations, running operations, like if you're a company that has 50 employees on a job site, can you do it with 25? It's all going to depend, it's all going to depend on your operation, what you're doing. And the business of construction is very cutthroat, as we all know, and bids are more competitive than ever, so now it's going to become a lot of legalities between project owners and the firms that are building these, right? Okay, can we have more time? Can we have more time to build it? Can we have more money
Right,
to build it?
right.
'Cause now we need more PPE, more people. There's no way of really knowing. That's tough.
Right. And if I could just add, I think for those of us on the call that are small business owners, we're not Skanska, we're not Turner. And one of the things that has helped us grow our businesses here in the state of New York is, being a minority-owned business or being a woman-owned business, being certified with the state, with the city, with the Port Authority. So what I kind of see happening is, and Aldo eloquently brought it out, who is Skanska going to bring on their team? When we're presenting ourselves as an MWBE firm, it's not enough to say, okay, we have our skill and we're MWBE, but we need to prove to the Skanskas of the world and all of these, the Turners of the world and the Tishmans, that we have our policies and our procedures in place to deal with the pandemic. Because if not, we really can become a liability to a larger construction company. One of the things that we've been hearing now, since we're dealing with some of the larger players, they don't want MWBEs on their team. And it's not because we lack the skill, but we don't have the business plans. They don't want a liability. So following a lot of these great recommendations that Aldo made can help us have our infrastructure and really show that we are ready to work. Because many times, as we know, we're not going to be the prime. We're going to be a subcontractor.
Right.
Most of these big projects, we are not going to be the prime. So by taking the time to put these things together for our own shop, when we're meeting and we're going after these jobs to be a sub, it'll make us stand out. That's just something to add to that question.
Thank you, Vanessa. Thank you, Aldo. Appreciate
No
it.
problem. A pleasure.
Were there any other questions? I know someone said, can you get the documents? Yes, you will. So we sent the packet over, but there's 2 other forms that we're going to send over as well. Looks like there's no, Aldo, you were amazing as usual. Thank you.
No. Thank you, guys. Appreciate it.
So Bachnet, did you have anything in conclusion to share with the group?
No.
Okay. All right. Well, guys, thanks for letting our team at Precision be here for the construction, and we will look forward to seeing you all soon. Have a great day, and you'll
Thank you.
definitely get in those documents. Take care, everyone.
Take care.
Bye-bye.
Thanks all. Thank you. Thanks, Aldo.
Yes, sir.
Have a good day. Bye-bye.
Bye-bye.
Thank you.